Once I know my stuff, I'll be like, oh, certain color.
So with this, we want to monitor for recurrent bloody diarrhea. Okay, so no NSAIDs, right?
Mm-hmm.
Okay. When you are, and this is just kind of like a point, just kind of to know.
Okay.
When you are taking an iron elixir, you want to be mindful to take it with what?
Calcium?
Vitamin C.
Oh,
right? Vitamin C helps absorb iron. So like orange juice, right?
Right. Take it with your iron.
Don't take it with milk. You're going to inhibit the absorption. All right. For a patient that is taking spironolactone, you want to enforce that they refrain from consuming salt substitutes. Why? Salt substitutes are high in what?
Sugar, salt.
Potassium.
Really?
Mm-hmm. Salt substitutes are high in potassium. So like Mrs. Dash is very high in potassium.
I didn't know that.
It is.
I was like, it's so good. There's no salt and
stuff. It's high in potassium. So if it has low salt, then it has
Does
high.
It say it?
It says salt free. And
It says salt free. I know that,
but if you look on the potassium, you look how much potassium it has in it. Yep. So anything that's salt free has high potassium. You know, they have an inverse effect.
Got it. Let me just put that there. I didn't know that.
Salt substitutes are high in potassium, and spironolactone is a potassium-sparing diuretic. So if I am taking this medication and as well eating things that are high in potassium, I'm going to put my heart into what?
Effect of cardiac arrest or low, high potassium. It could speed it up. No, it makes
low heart rate. Remember high potassium?
Yeah, low heart rate.
Yep.
Low heart. It slows it down.
Slows it down, right.
Yeah.
So when you have a patient, so let me put this in question form. You are the nurse caring for a patient who has a diagnosis of CHF and is taking spironolactone, 25 milligrams every day. The patient explains to you their diet in great detail, including Mrs. Dash as a replacement for salt. You, the nurse, want to monitor what symptom of hyperkalemia?
Monitor what symptom?
Bradycardia.
Right, because it's going to slow the heart rate down.
Right. All right. Moving forward. Babinski sign. What is Babinski sign? It's a test for neurological function, correct?
Yes.
Okay, so when you strike, so like let's say this is the foot, right?
Okay.
When you strike the sole of the foot, okay, what are the toes expected to do? Are they supposed to curl or are they supposed to fan?
Fan. Curl.
Curl, right?
Right.
So when you strike the sole of the foot, you expect the toes to curl. That's a good sign. If you strike the sole of the foot and they fan, that indicates brain
damage.
Exactly.
Wow, that's how you indicate the brain. Okay.
Curl your toes is good. Fanning is bad.
Fan. Been always trying to remember that one. Brain.
Blood transfusion. Sign of allergies in order. Okay. Flank pain. Frequent swallowing.
Flank pain would be frequent swallowing.
Flank pain and frequent swallowing. Rashes. Fever and chills. Those are allergies of a blood symptoms of a blood transfusion allergy. So if you're running a blood transfusion and the patient is experiencing an allergic reaction, your first thing to do is do what?
An exam. To check for rashes or fevers.
Stop the blood transfusion.
Oh, stop.
Yep. So the first thing you want to do is stop the transfusion, and then you want to run normal saline, right? Because when you're running blood, you're running it with normal saline.
Okay.
For that purpose, in case you have a blood transfusion allergic reaction, you can stop it and blow that line of saline open.
So that way you can run it out.
So you can run
it out right away.
Right.
Okay.
Okay. And of course, you want to obtain vital signs, and you want to, notify the physician after that. Okay. So just think of it like this. Yeah, I know you chose an assessment answer choice, but when you are looking at situations, when it's an emergent situation, assessment answer is not your best answer. You want to intervene. Okay? Just for example, we're sitting here talking. If I fell out on the floor, I don't want you grabbing a stethoscope and checking my lung sounds.
Okay.
Right? I want you to do something. Right? I want you to intervene. I want you to try to save my life.
So do not, if it's an emergency, do not do any vitals.
Because
it's not necessary.
Right. It's not necessary to do an assessment. You want to do an intervention. So an intervention would to be first check to see if I'm breathing, start CPR, call 911, things of that nature. Okay. So that would be kind of like an intervention. All right. An assessment would be like checking my pupils and things like that.
Yeah,
that's unnecessary when it's an emergent situation.
Okay. Right, like when you first go to a doctor's office,
right.
You start off with certain assessments. Okay.
For example, you're caring for the patient with esophageal varices, okay? And they use what's called a Sangster-Blakemore tube, and they put it down your throat, and that is to treat the esophageal varices.
Okay.
Now, let's say that the patient decides to go into respiratory distress. What will be your initial reaction?
Stop it and start CPR?
No, they're not breathing. Their heart hasn't stopped. They're just having difficulty breathing, like a pulse ox of 84.
Oh.
Yeah.
So remove it.
You want to remove the tube.
Yeah.
Right? You want to remove the tube and then give them O2 and get them comfortable.
Yeah.
So your initial reaction would not just be to give O2. Your initial reaction would be to remove the tube that's causing the problem.
Right.
Right? So that will be an intervention type situation.
Okay.
Makes sense?
Makes sense. A lot of sense. Yeah. Take it out. Because they're having trouble.
Right.
They're still breathing.
All right. Let's talk about the anemias.